Do you have any idea at this point when we might see the Omicron surge peak locally?
That's a good question. I'm hoping that what we're seeing now is our peak. I know there's been a lot more activity on the eastern side of the state. We seem to, historically, we've always trailed behind. And we've seen this gradual ramp up in a lot more positivity in terms of people who are coming in with symptoms and ending up testing positive for COVID. Those numbers have really been going up over the last 3-4 weeks significantly. So obviously there is a kind of a surge going on. But we don't seem to be seeing, we're seeing a lot of patients in the ED and in our urgent cares. That seems to be the kind of level of healthcare needs that they have. We do have some that are up in ICU. There's still that numbers that comes in. Just I think the sheer bulk of the number of people that are getting sick, you still have that group, small group that is showing up here. But I'm hoping we're at levels that we saw back with our very first surge in terms of the number of folks that we have in currently. It's ballpark. We're running in the 30s. In terms of COVID patients.
Okay.
About half of those are people actually in because of their COVID, and the other half are people that are coming in to have in for some other reason, and when we screen them we find out that they're positive, so we still end up having to handle those folks with isolation and whatnot, but aren't requiring all the medications and the other stuff that like the true COVID patients are having now.
Another provider told me that the majority that are hospitalized are unvaccinated. Is that?
That's correct.
Okay.
Yeah, I think we're running around 80%. I think it's kind
Okay.
of what other people across the country have been seeing too. It's upward 80 to 90% of the ones that are making it, the really sick people coming in.
Okay. So if you contract COVID, whether vaccinated or unvaccinated, what can you do in terms of like care for yourself at home? What do you need to?
It's just the usual sort of things you do with cold, flus, and those sorts of symptoms. Taking medicine for fever control if you're running a fever, keeping yourself hydrated, making sure you're eating, adequately, just the usual good nutrition, resting, staying away from others, hand washing, wearing masks, all the stuff that we've have been talking about. That hasn't changed at all in terms of what you need to do to keep other people around you healthy and then for yourself. And then consider, depending on how sick you are or how high risk you are, then there are some of those medications that you can get as an outpatient that we do have.
So now with the Omicron, it's the Trova Map?
Trova Map. Mm-hmm.
Okay. How can you get that? How available is that in our area?
It's difficult to get. We're on allocation from the state. The state determines which of these medications get sent to which hospitals, and it's based on how many cases they have and things of that sort, and it's on a weekly basis. I think we only have one dose of Trova Map currently in the house, and that's already it's already been arranged to be given to someone at some point here. I'm assuming today, probably.
And this is something that's nationwide. There's a shortage of that.
Absolutely, it's just being used much faster than it can be supplied and manufactured.
Let's say that somebody contracts the virus. At what point should they seek medical attention? Do they need to call their physician right away, like if they would test positive?
Well, if you're feeling badly enough, like I say, where you think you need to talk to a doctor about, getting something for this because it's I'm running a fever, I'm just feeling crappy. There is some Paxlovid, which is the oral medication that Pfizer's come out with. It's gotten the emergency use authorization. My understanding is, I don't know that it's available in town. I know that there supposedly is going to be something coming from the state level to a couple of the different pharmacies in town, but I don't know who's going to be the designated point. Mm-hmm. So there is that option potentially to take one of those medications. It's a 5-day course of stuff that you take. You take, I think, 3 pills twice a day. It's kind of a combination of two different meds. One that's has been used to treat HIV, and this is different than what we're talking about the monoclonals and the things that you have in terms of as an infusion. I myself, I think people who are having symptoms, and if they're going to be out in the public and around, it's probably wise to get tested to see if you are contagious or potentially a hazardous risk to somebody else. And then you kind of noted that you should isolate yourself if that's necessary for what the recommendations are coming from the CDC. So I think knowing is better than not knowing for most folks. And that's a challenge too in terms of being able to get testing done. And the symptoms that people are having now, it's almost indistinguishable from head colds and other things. So you really can't tell whether you do have it or don't have it. You really need to get tested.
Who should you reach out to first? Should you contact your family physician and then they'll...
I would tell, yeah, it's best to do it as quickly as you realize that you've done it, get yourself tested, confirm that that's what you've got. And then, it would be to talk to the family docs, because they can order up and prescribe the infusion. They call our admitting folks upstairs to schedule the appointments, and we are typically are booked several days in advance. So
okay.
The sooner you get yourself on the list, the better.
When do people start feeling better? Do you have any idea?
I know with Regeneron and whatnot, folks who are feeling poorly said within 24 hours after having gotten the infusion, they could tell the difference in how they were feeling. Symptoms, it had a real dramatic effect for them. So they do know something's happening when they've gotten it. And that's the other thing I don't think people have realized or understand about vaccines, because a lot of the vaccines we've had in the past have been very effective, and we've gotten so many people vaccinated that we think these diseases don't exist anymore. The problem is we've never gotten, unfortunately, if we had gotten a better response from the public to get vaccinated when that became available, we could have dramatically reduced the number of people that could continue to transmit this virus and allow this thing to mutate. So that still is the best strategy for what they could do is for outpatient for prevention is to get themselves vaccinated. And then masking really reduces the chance of you potentially getting it, but if you do get infected, it really dramatically reduces the risk that you're going to potentially make someone else infected with